Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Cold temperatures in Arkansas over the past couple of weeks. So today, Dr. Bushra Shah joins us with the St. Vincent Longevity Center to talk a little bit about hypothermia and frostbite. You may think that these don't happen in Arkansas, but they can, right?
Absolutely. Basically, hypothermia is when your body is losing heat faster than it's able to generate heat. And when your core body temperature drops below 28 degrees Fahrenheit or -2 degrees Celsius.
Right.
And, you know, what happens is that the body triggers this life over limb response, basically trying to rescue the vital organs and directing circulation towards your vital organs and therefore sparing the extremities or the periphery. So that would be your ears, your nose, and your fingertips.
Right.
and your toes, which are more susceptible to then getting frostbite. So, you know, hypothermia hence leads to frostbite, or direct exposure to cold, snow, ice, or a very cold metal causes your body temperature to drop and therefore damage to the skin and the tissue and resulting in a frostbite.
Yeah, you know, we have hunters, we have hikers, sometimes they get lost, and we have heard of this happening. Let's put up first some of the symptoms for hypothermia to look for, and these are some of those.
Yes, if you suspect somebody to have hypothermia, they may have some or all of the symptoms, but they'll be shivering, they'll be clumsy, they'll be unable to talk clearly, confused, very lethargic, low energy, maybe even unconscious. They will have a very weak, thready pulse because there's poor circulation, and then they may even be breathing very shallow.
Okay, let's talk about what you can do for somebody then, because you can do emergency aid.
You have to immediately, because if you don't, eventually your heart will stop beating and you will die. So it's very important to act quickly if you suspect hypothermia. Get these people to a warm, dry place. If they have wet clothing, remove the wet clothing. Keep them warm by wrapping them. Skin to skin, bare skin to skin, warm body heat. So you may want to take your clothes off and generate heat between by warming them up with your own body heat. And warm beverages actually cool from the inside. Warm from the inside.
Warm from the inside. So hot chocolate,
yes.
Something warm for them. Okay, let's go on to frostbite then, and some of the symptoms are a little bit different.
Yes, because frostbite is basically from where the areas of the skin that are exposed, and that'll be your nose tip, your fingertips, your toes, extremities, ears, cheeks. So you might start feeling numb or pins and needles in that area. The skin becomes pale or yellowish gray and kind of a hard, waxy appearance. It's hard to touch. There may be, if the nerves are not damaged, you may have pain and a throbbing sensation. But if the penetration is deeper, you may have no sensation, so lack of sensation.
Okay, and a way to prevent this, it has a lot to do with the way you dress, right?
Yes. You have to, if you are one of those people who are especially at risk of having frostbite, diabetics, those with neuropathy, circulatory problems, on certain medications that decrease blood flow to the periphery, then you should especially be careful, anticipate the weather, wear mittens, not just gloves. You should wear layers of clothing. You should maybe double up on the socks. You should wear water-resistant clothing or windproof clothing. Cover your head with a hat, your ears with earmuffs or the hat, and therefore not expose those areas that are susceptible to the cold.
Those things make a big difference, the things that we say, and then of course find shelter if you are caught in a storm for either of these. So we want to remind everybody about the Longevity Center. Of course, at St. Vincent. Did you have something else you wanted to mention?
No, there are certain conditions that, like those who are on beta blockers, those patients who have diabetes, those who have circulatory problems, a condition called Raynaud's phenomena. So if you are one of those people, and with this weather, please take precaution and check the weather, because, and you know, the longer you're out in the cold, the higher the risk of getting frostbite.
Right.
And it can be a life-threatening condition. You can lose a limb if the damage is deeper into the muscles, tendons, nerves. And if you cannot treat it at home or provide first aid for frostbite at home by thawing your skin, you need to seek medical help immediately. And if you see that the frostbite area is becoming discolored, darkened, if there's drainage, then you need to see a doctor immediately.
Okay, Dr. Bushra Shah, thank you so much for coming. I think a lot of us don't think about it here with our mild winters, but it can be harsh. Thank you so much for coming today. We'll be back in just a moment as we will check on your weather.